Okay, I think we're going to get started. Welcome, everyone, back to our meeting on global violence prevention. And it's my pleasure to moderate the panel this afternoon. And for the last day and a half, we've been talking about knowledge accumulation, how we develop knowledge, how we apply it. And I really feel like this panel is almost where we take that knowledge and where the rubber hits the road. So we've talked about some of the best ways to develop programs, what works, what doesn't, where to find it. But I have the pleasure of having 4 people with me today to talk about what evidence means for their practitioners. So these are representatives from 4 different fields where violence impacts their practitioners. They have practitioners who are responding to violence in various ways. And these, as you'll hear from them, these are practitioners who, by and large, probably aren't going home at night and reading scientific journals. And so our question is, how do we get the research to them? And so we're going to hear from them very candidly in an interview format about this problem. So from the law enforcement community, I'm delighted to have Jim Bueermann here to my left. He was recently appointed the president of the Police Foundation, America's oldest nonpartisan, nonprofit police research organization, this past September. Prior to his appointment, he served as an executive fellow at my agency, which is the National Institute of Justice, for a year. From 1978 to 2001, he was a member of the Redlands Police Department in California, where he served his last 13 years as chief of police and also director of housing, recreation, and senior services. To his left, we have Virginia Dolan. She has spent 30 years in education in multiple roles, employed in 5 school systems in 4 states, as a middle school teacher and special education teacher of adjudicated adolescents with emotional disabilities, school psychologist, and central office administrator. So if we want to hear about the educational perspective, I think that she certainly has the breadth to help inform this conversation. Since moving to Maryland, she has spent 15 years as a school psychologist throughout Arundel public county schools. To her left, we have Joan Serra Hoffman. She is a U.S., Brazilian, and Portuguese national, and she is a violence prevention specialist with 20 years of experience in policy design, implementation, research, and network building, with the focus on bridging the gap between researchers and practitioners. She currently is at the World Bank as a senior researcher in citizen security for Latin America and the Caribbean. Finally, we have with us today Tammy Mann. She is currently the president of the Campagna Center, a community-based nonprofit that serves 1,700 children, teens, and adults in the city of Alexandria in a range of education and human service-related programs. She has worked for the past 20 years in settings that cut across practice, policy, and research to have a healthy respect for just how difficult it can be to translate evidence-based research into practice and policy. So we know that you've all been sitting in here for a day and a half now, and so rather than these folks could have talked with you, having some slides up here and gone through the same drill, but we wanted to vary the format a little bit. So this afternoon we're going to do this with an interview style. And so I'm going to ask a question and give each of our panelists an opportunity to respond. And if there's time, we'll leave some time for some questions and answers. So the first question I have for our panelists is, bearing in mind that this is a very broad audience that we have in this room, our 2 overflow rooms on the webcast, we've got folks from public health, public safety, development. We've had questions fielded from groups of OBGYN groups, from UN groups. This is a diverse audience that you're speaking to today. And so they may not know what each of your fields looks like. So the first question is, I'd like you to describe who your practitioners are in the field that you represent. Jim.
Good afternoon. My day has been very interesting. I started off over at the Dirksen building at Senator Feinstein's press conference on banning assault weapons. And so I'm here now talking about violence and evidence about violence. So my day has been bookended by the political nature of this issue of violence and the scientific perspective on it. And I say that because that represents, to a large degree, the way police chiefs and sheriffs, to some degree, look at this issue of violence and the evidence around it, and what can we do within policing. Policing is a very interesting field in that not all policing is the same. It varies by state, by region, by the nature of policing, and within any particular police department, the way that line officers, patrol officers that are responding to calls view violence and what they can do about it is very different than the way their chiefs do. So you have people that are in the trenches taking a very practical day-to-day view of what they do, and their perspective on evidence, for instance, is I don't really need to know the theory, just tell me what works, tell me what you want me to do, all the way up to through the ranks where their line supervisors or their division commanders have an increasingly strategic view of this to the police chiefs who become, if they are astute, brokers, if you will, of the scientific perspective, of the political, and of the practical perspectives of violence reduction. So that good, thoughtful police chiefs will use the bully pulpit that they have in every community that I'm personally aware of when people want to talk about crime and disorder, and violence is clearly part of that. They usually will talk to the police chief or the sheriff, right? Rarely do they pick up the phone and call the library director or the fire chief or somebody else. We still want to define crime and violence in most of our communities as a policing problem when it should be more holistically viewed. It really is a public health issue. It is really a political issue. It is a community issue. And so in my role as early in my career as a street cop and a detective and all of that, and I left the business in 2011, so I kind of conducted my own personal longitudinal study of policing and evidence and culture in my own department. So I spent that whole time in a Southern California Police Department. And as the police chief, I spent a lot of time trying to translate for line officers the rationale for why we focus on these things. And that was a very different conversation for me than speaking to the command staff or speaking ultimately to the city council or the community at large. So when you think of the practitioner in policing terms and this notion of violence reduction, there are multiple practitioners who all hear the message differently. They're all capable of hearing it differently for a variety of reasons. I won't spend a lot of time at this moment talking about the culture of policing, but I will tell you that if we ultimately want to see the police use increasingly more evidence-based practices, we have to think about cultural change. We have to think about pulling the levers of change in the world of policing. Police chiefs are largely not driven by the metrics that you might think they are. They are driven by culture, political and community expectations. I was a police chief for 13 years, and never once, ever did one of my political bosses ever say, so chief, tell me about the evidence-based practices you guys are pursuing, and can you show me that this huge amount of tax dollars that we're spending on all of this stuff that you guys have actually makes any difference. That has never happened. When I was hired, I've sat on, I can't even tell you how many interview panels for police chiefs where we were interviewing candidates. That's never been one of the questions. So, maybe we'll get into this later on, but I truly believe there are levers that we can pull that will change the way the police think about these things, because you change the reward systems. In my own agency, that's what we did. We wanted the cops to get smart about this stuff, so we changed the reward systems, the metrics for those reward systems, so that in their promotional interviews, we were talking about school resource officers a minute ago. We had school resource officers K through 12 in our city. That was a competitive position, and the questions we asked them about that had nothing to do with police work. It had to do with theory and all of that. So when you change the questions in the reward system, suddenly they start doing their own research and lit reviews and things around that, and it just changed the dialogue we had. But it was a different conversation for those people than it was speaking to city council members or city managers who, by the way, are probably the single most important untapped, discussed and ignored resource in a city system if you want to change the way cities and police departments deal with violence.
Thank you. Jenny?
Good afternoon. Thank you for this opportunity. I hail from just down the road in a country called Maryland, in a school district named after the wife of Lord Baltimore, Anne Arundel, for those history buffs. We have a very, very diverse and large school system, over 77,000 students, 125 schools, all the way from Baltimore to the boundaries of Baltimore to rural Maryland, along the banks of the Chesapeake, the National Security Agency, Fort Meade, Maryland, Annapolis, the Naval Academy. And we have a growing homeless population, growing immigrant population, and incredibly wealthy families. So we are a microcosm of the United States of America. Our stakeholders are just about everybody in this room: our citizens, our teachers, students, parents, our administrators, our policyholders, our policymakers. And that's what we've done around violence prevention. We began this process in 1998. And at the time, we were about exclusionary, punitive processes. Kick the bums out, get rid of them. Send them somewhere, but not to where our kids go. And then along came No Child Left Behind. But along the way, we met some folks from the University of Oregon and who also were working with Dean Fixon. And I would like to say everything Dean Fixon said this morning is what we've done and tried to do, and it's no easy task. But our folks in Oregon helped us with the principles of a multi-tiered system framework. And as I participated in the discussion this morning around Nairobi, the case study, I thought of this. And I think some of and I'm jumping the gun, but the pitfall that we fall into, at least in education, is trying to hang the bauble on the Christmas tree. Try to find that practice, and that's going to get you the bang for the buck, and that's going to be the panacea, the silver bullet, and get the best effects. But there's a lot more to it, and that can't be alone, and I'll tell you more about it later. So I think that's basically what I would say.
Okay, thank you. And Joan, can you tell us a little bit about who comprises, your constituency? Who are the practitioners in your field?
Sure, and I feel very fortunate that I'm joined here at this meeting by one of my colleagues from the World Bank who sits in the anchor, Alice Woolman. She'll be speaking. Oh, sorry, should I repeat myself? Okay, very well. I said I thank you very much for the opportunity to be here. A little closer. Oh dear. Okay. Okay. Is that better? Lovely. Well, thank you very much for the opportunity to be here. And I just wanted to recognize that I am joined as a World Bank representative here by my colleague Alice Woolman, who will be speaking in the closing session today, who represents the Anchor Group. So for the purposes of this, I wanted, since the World Bank encompasses such a big universe, to focus on Latin America and the Caribbean, which is the area where I'm working in. So we have a very diverse group of practitioners. We have, but in many ways over the last 10 years, we have been able, as a field, to really begin to address violence prevention and crime prevention as a hemispheric problem, and through efforts of bringing together colleagues and collaborators such as the CDC, the World Bank, the Inter-American Development Bank, the OAS, PAHO, the WHO, UN Habitat, and others, begun to develop a methodology for work in the region that really privileges violence prevention, that looks at it as an obstacle to health, to economic well-being, to social development, and citing it as a development issue. We've been able to achieve that. And now within these respective agencies, there are dedicated staff and units that are beginning to address this work. The World Bank is, I think, not a newcomer, but is also now very firmly addressing this issue from both at a global level and at a regional level. As such, there's tremendous variation in the region. We have countries with challenging infrastructures. We also have countries that are on the forefront of social policy innovation. We have big countries, small countries, poor countries, richer countries, rapidly developing countries, countries in which inequality has grown. As a whole, though, there has begun we begin to see establishments of networks of policy-oriented academics, visionary mayors, practitioners that are extremely seasoned, who are knowledgeable and avid consumers of the research that we produce. But most of them, I think, what distinguishes in terms of their consumption and what types of materials that they're looking for is increasing interest in community-level approaches and looking at what does a portfolio of approach look like at a municipal level. Municipalities are very important because of the concentration of population and the concentration of violence in Latin America and the opportunity for integrated governance. So again, looking at opportunities to draw from the evidence base, particularly where you transcend single sectoral silo solutions, where you focus on improving systems, tying it to governance and democracy, and trying to address various types of violence and links among the different types. Another audience group of our practitioners are practitioners that reside within the multilateral organizations. The level of expertise varies greatly because this is a topic that has recently arrived on the development bank and development agency scene, and many of them are learning. So we have, part of our work is to educate members within our own institutions about the problem of violence. Violence is a development issue, as a health issue, as an education issue, as a transportation issue, as a governance issue. And this provides a lot of opportunities because to the extent that we need to develop a holistic understanding of violence as a challenge to development, it gives us opportunities to potentially draw upon some of the research, some of the innovations in other sectors, whether it's transportation, housing, urban planning. Another key constituency are government officials, national, state, at the municipal level. These are the primary, in some ways, stakeholders. And again, there's tremendous variation in terms of how ready, willing, and even their ability to comprehend some of the research findings that we've been able to accumulate over 20 years. But on the other hand, we also have extraordinary leaders that encompass both the policy practice and the research in the body of some of the leading mayors in the region, of which Rodrigo Guerrero is one of them, but he's stepped away briefly. So I hope that gives you a little bit of an overview of our audiences. So.
Tammy, in telling us about your practitioners, because you really have such a breadth of practitioners that you represent, help us understand, what some of those occupations are that are represented in your fields.
Absolutely. So as was said, I am just across the river managing an organization of about 200 employees that are providing early childhood education services through Head Start, Early Head Start, and state-based preschool programming, after-school programs on the elementary side, youth development programs on the middle and high school side. And so when I think about who the people are, I'd like to kind of embed it in a nonprofit sector framework first, because I think that's very important as you kind of listen and think about differences between what public sector capacity is compared to the nonprofit sector capacity. That's a very important point as we sort of get to what it really takes to do this work and do it well. So I'll say that first, and then I'll say when you look at early childhood educators, they range anywhere from individuals that might have a child development associate credential, which is like an entry-level credential at the sort of floor of what you might find in an early childhood setting, depending upon whether it's Head Start, childcare. I have to sort of bring the full mix of people that are doing work in the early childhood field forward to people that have master's degrees, advanced degrees, that have had extensive experience, not just doing, but thinking about how to design effective curriculum strategies and support educators in the work that they're doing with children. on the, because we're also doing work with family development, you have individuals that are credentialed at the social work level, bachelor's level social workers, master's level social workers. I think this sort of appreciating the range of educational experiences is a very important piece of understanding how difficult it can sometimes be, depending upon where you are in your own experiences, to translate some of this work into kind of how do you make sense of it and do something about it. I'd also, we have health educators that are a part of our mix. In addition to volunteers, we don't talk so much about volunteers, but again, because I'm looking at this from the nonprofit sector perspective, we have to kind of think about our entire capacity of individuals that are involved in our work. And there's some very unique opportunities and challenges that come with engaging sort of the civic element of capacity in the work that happens in the nonprofit sector.
So the next question I have is, recognizing that your practitioners are really the consumers of the research that is created, I'm very curious in learning how and from whom practitioners acquire this research. That is, how do they find out about a study that has importance for their daily work? And just as equally important, how do they find out about some practice, some policy that should be abandoned, that's not working, that might actually be causing harm? And I think just to sort of vary this, Tammy, maybe we'll start at your end and work down.
Sure. So how do they find out about research? Well, I don't want to say in a haphazard way, because that might sound somewhat irresponsible, but the reality is there is a trickle-down sort of effect that happens. And I think actually the comments that I heard Jim make sort of get at this, because clearly the level at which you're operating in a program is going to affect your access to information that can help improve what you do. And I think a lot of practitioners do rely on, in terms of what they get, and I mean frontline folk that are working with children, with adults, day in and day out. The conference experience tends to be the place. And if you can think about the conference experience and what it's like to kind of go away for 3 or 4 days and immerse yourself in all of these new and interesting things that are happening in the field, and then have to go back to your agency and say, okay, it's Monday morning, so what? What do I do with that? How do I sort of hold true to the excitement that I felt when I was there, and all of the things that went through my mind about what we can do, what we should be doing, and then take that back? It's a very, very daunting thing. And a lot of folk argue against, these kinds of trainings they're not very effective, so we really shouldn't do them. And while I certainly agree, and I think there was a slide that spoke to this, we spend money in that way. And I think, yes, we should be doing different, but I also think that those environments can help set the stage for people wanting to change. And the idea of developing relationships with peers that are trying to do this work can sometimes get discounted as another value add piece of that. But that's one way direct practitioners get their information. I think if you're in an agency where you have the benefit of partnering with a local institution of higher education, you're going to be better positioned to be able to take advantage of what's coming out of sort of the knowledge factory, and how that then should get incorporated and translated in the work that you do. All agencies don't necessarily have the sort of leadership connections that afford them those opportunities, so that can sometimes affect access or not getting access. Where you've been and how varied your experiences have been professionally, those matter too, the kinds of networks you are a part of. It really is, it's not systematic. It is, if you're in sort of the right place at the right time, sometimes with the right people, you manage to find out what's coming that you ought to be thinking about. And I'm talking about really being on the ground in a community context where you're really focused on some of the challenges that I think I heard in the presentation this morning from the woman from Jamaica, or I could be remembering the setting incorrectly, but because I was cold this morning, and cold does affect my ability to sort of be as attentive as I would like. But it reminded me of some of the realities that, you know, when you're on the ground day in and day out, you have to sort of contend with to stay on track and stay abreast of knowledge.
Well, I think having sort of given you an overview of the types of practitioners that we have, it really varies. I mean, we have some practitioners that have access to specialized journals, that can read in English, that have access to university settings, but we have many that don't. And so just language alone is a limitation. Cost in terms of accessing some of the journals where your research is published is prohibitive in many contexts. So in terms of getting our message out, we try and rely a lot on using the internet, trying to bring together specialized seminars where we are very deliberate about the types of experts that we encourage to present and to participate in these events, that can understand the evidence but also the limitations of it, that are cognizant of some of the challenges of implementing it in resource-challenged contexts, that are also knowledgeable about the cultural context, and of course there's the issue of language. So these become considerations in terms of how we can try and disseminate our work. Increasingly, the World Bank is developing toolkits around specific issues in crime and violence for our specialized audiences. One was a crime prevention toolkit that was actually modeled on some work that was done in South Africa. That's now an e-learning course that is delivered through the TEC in Monterrey. In the last year, we developed also a toolkit for integrated municipal and community school violence prevention initiatives. And that was developed a variant of that was developed for the English-speaking Caribbean and Africa. And within these toolkits, we try and sort of cull out what are the relevant studies, discuss key findings, try and pull together the types of assessments, questionnaires, survey items that are in the public domain that are freely accessible. Those also that have been tested and implemented in non-English speaking, different national and cultural contexts, and having them really at the fingertips of the users. Typically, these events are also accompanied by seminars in which we bring local experts that can speak about the challenges of implementing school and community or school and municipal crime and violence prevention initiatives in that given country. Researchers that have done bronze or silver standard evaluation in that area are also invited to attend. So I think that gives you, I hope, an overview of how we have our practitioners, or how our practitioners acquire access to evidence.
Well, evidence-based research, evidence-based programs is not exactly a popular term in education, specifically with teachers. So it's up to middle management and upper management to sell it, to socially market. Now, I say that at the same time, every educational group, whether it's folks from psychology or counseling or student services or teaching, instruction and curriculum or administration, they all belong to professional organizations. And if they're lucky enough and have the funding, they can attend conferences where they can hear good information. And hopefully there's journals that they can consume. But the reality is that when the rubber hits the road in the classroom with the teacher, it's the middle management, upper management that will provide that information to them in the form of professional development. Our guidance in education is often taken from the state departments of education with high stakes testing. And that's what it's all about. So what we've had to do is we took a prevention model and used a systems approach, and we had to connect the dots for people. So while we wanted, the folks wanted to get rid of the bums, who were violent and destructive and obstructionists, we had to say to them, at the same time, we're now accountable for everybody. And so we need to teach them. And they need to remain in our schools and in our classrooms. So how do we do that? So while we provide evidence-based programs to the students as a stakeholder, really our primary audience and target are the teachers, and to build up their toolboxes so that they know what to do, what not to do, when a child starts to escalate, when a child starts to get potentially violent. We have to help our teachers with the toolbox, the toolkit. And we have found that by growing it from grassroots, we can get to the top level, as Dean Fixon talked about. So one of the successes we had was taking a few principals in a few schools, and we contextually fit, very important, some of the critical features of the multi-tiered system and got them to, they were able to show some outcomes, and they showcased it, and that got attention. And that has been sort of our roadmap to do this work. So I hate to burst bubbles here about evidence-based practices. Many of us use that term, but it's a turn-off term to teachers. And the reason why is there's a lot of things on educators' plates. I don't know if you've been in classrooms in recent years. They're inundated with data. They're inundated with new strategies. They're inundated with the testing. And so if you say we're going to do this program, isn't this wonderful? And boy, this comes out of this wonderful institution, and they're going to look at you and say, how much work is it? What do I have to do? And I don't have any more time.
Jim, just to follow up on this question, if you can again share with us, how and from whom do your practitioners acquire research? How are they finding out?
So this may not be fun to hear because I think we all want to believe that our tax dollars and our local police departments are evidence-based and everything they're doing is a really thoughtful approach to things, but that's not actually what happens. In a place that has more than 17,000 police departments and sheriff's departments that has 50 different training systems across the United States with no national standard. I realize educators may not like No Child Left Behind. I've often thought we need No Cop Left Behind legislation, though, to create a national coherence about how we think about public safety, because really, I think there's a difference between rural, suburban, and urban policing, but at the end of the day, violence prevention looks very similar regardless of the context and where you are. Things work or they don't work wherever you are. The problem is there is no incentive, really. There's no national incentive. There is no agreement on measuring what matters and those metrics about how we look at success. I don't think those are difficult to get to, which is the upside. I think that with some thoughtful work, this could happen. But if they're not in this room, part of what will keep that happening is that people should also be in here, are city managers and local mayors and some elected people, because those are the folks at the local level that make the decisions about what happens. Unless there's some national legislation that drives, at least in my community, that drove educators to do something. The Board of Education is who told the principal, the superintendent, who told the principals how the schools were going to be run. But this national coherence about this, whether you agree with it or not, at least created some form of everybody sort of getting on the same page of music, right? That doesn't exist at all in policing, at all. It's not even close. So it is very episodic. There are emerging kind of opportunities for police officers at the line level and certainly up through as they matriculate through the ranks to get smarter about this stuff. It is not a problem of access, by the way. If you have access to the internet, you can get this stuff. That's not the issue. The issue is, do I understand it? There is a huge translational issue between how many of you who are on the science side of this equation study, and more importantly, you write about your work and how we look at it. I can just tell you that most police and chiefs and sheriffs are more like firefighters than they are anything else, because they run from one organizational fire to another, whether it's politics, budget, union issues, personnel. They spend a remarkably small portion of their day dealing with crime issues. They deal with all kinds of other things, which is another problem in and of itself. But there are emerging programs that begin to incentivize if you want to move up through the ranks, depending on the local culture that values education. Remember that the standard for education in the United States for police officers is a GED. That is across the board. Now, this is problematic in places where they make a lot of money, like in my home state in Southern California. It is not uncommon for street cops to make $200,000 a year with overtime, right? So, and there's places in other parts of the country with a GED. So think about that. And I think, there's problems with that, but that's another story. So Cambridge, George Mason, some other places are beginning to have and use these terms, evidence-based policing. But the work I was engaged in last year at NIJ was all about translational criminology. And it was the notion, right, that we can take really good science and how do you translate it in a very effective, plain language, practical terms. So not only do the people that are making the decisions for those people on the street understand what the science says, and this is the toughest part, how do I translate that finding into something that makes a difference every day in the lives of the people in my community. In my department, I won't go into all this, but in the late 90s, we used a research model. You can agree or disagree with this model, but it's called Risk and Protective Focused Prevention, and we recrafted the police department framed around, you may have heard Katrina say this, that not only was I the police chief, but we had consolidated in the police department housing and recreation and senior services based on this model of identifying and reducing risk to lower delinquency, violence, substance abuse, dropping out of school and teen pregnancy in young people. And we did that as a result of a significant spike in the adolescent homicide rate in our community. So we reframed the whole police department around an evidence-based practice, and as a result of doing that, we changed these internal incentives and ultimately ran 5 randomized control trials within the department about a variety of things. So we were a little unique in that, but we did that because we wanted to, and we thought that was important. We did not do that because my political bosses said we should do it. We didn't do it because there is a national standard that says you'll do this. We convened a meeting on mental health related gun violence last week, and one of the people in there was asking me, well, isn't it, when we're talking about getting the cops to do certain preventative things I think they can do to help prevent these mass acts of gun violence on a practical level? And she said, well, why don't you just do this in a national way? Just, get the feds to pass this law. Well, that doesn't work that way. The federal government, unless you were under a consent decree, has no ability to tell you, sheriff or chief, to get on the same page of music. And if you doubt that, I'll end this with this. Take a look at the difference in the way police chiefs and sheriffs are beginning to talk about this assault weapon ban. That's going to jumpstart this debate in this country, but gun violence and gun control. There are sheriffs in the western part of the United States that have already weighed in and said, whatever Congress may pass, we will refuse to enforce if it relates to gun violence. These are not the criminals saying this. These aren't the bad guys. These are the elected sheriffs because of the political component, right, that's been injected in that. So you can see we're all over the board, but there are levers. I'll say this until I stop saying it. There are levers that you all as scientists should be pulling or helping people like me pull to speak to the people, because this is not difficult to change that dialogue. And you change it not just through getting them smarter, you change it because you change their reward systems. If I want to be your police chief and you're the mayor, I'll sing whatever song you want me to sing. And if you're the person saying the song is evidence-based practices framed around violence reduction, guess what I'm going to sing? And as soon as I start doing that, what do you think everybody in my department's going to sing, because they want me to promote them? That is just the pragmatic reality of how police departments work, with some exceptions that relate to big cities and have civil service systems and all that. But, about 16,000 of the police departments in the United States operate that way. So.
Thank you. So I hear a lot of similar themes actually emerging across these sectors. And what I'd like to pose now is asking you all, what are some of the types of formats that make it most useful for staff in your organizations to access the staff information? I know some of you have talked about toolkits and webs, and of course language is a barrier. But what are those formats that seem to resonate best for, say, a social worker or a nurse or a sheriff, a police officer, someone working in the development community? Think about, how help us as researchers, those of us who are researchers, how we can better package our information.
I think I recently reviewed a document that was being put together for use in the community, and this was sort of a national center putting together a resource that was intended to help people be able to take and apply knowledge in the work that they're doing. And one of the things I commented on was they spent a lot of time focusing on the theoretical frameworks. And I think the people that are responsible from a managerial perspective, many times they get that if they're really tied into what's happening in their profession. They do understand these issues from a theoretical point of view. And so there's a tendency to really do deep dives around that. And when it comes to, so what does it mean? What's the implications of it? How do I then take it? It's very sparse. And it's sparse because I think sometimes there's a tendency to not want to prescribe for fear that people will become non-thinkers in what they're doing. And so much of what we're talking about does require element of judgment. And we've talked about adaptation and things of the sort. And so I think a little bit more attention to truly trying to focus in practical ways becomes important. And while I'm not expert in the use of these more digital formats of communicating, I think we've not had a conversation about how generational changes are happening and how young people that are coming into these various fields and professions are accustomed to digesting information in ways that are not akin to the traditional ways that we put out information. Podcasts, blogs, tweets, all of these social media driven ways of communicating. I think we're going to have to wrap our heads around how we package and talk about knowledge translation in those modalities, because that is a reality that more and more of younger professionals that are coming up through the trenches are living and experiencing. I have a 7th grader who has pretty much all of her textbooks online. It's quite unnerving to me as a parent who has become accustomed to the idea of, I would really like to hold my book, but they are being pushed to process knowledge and information, make connections in ways that are much more dynamic than the linear auditory. Getting at that alone is something that merits a lot more attention than I think we sometimes appreciate.
One of the ideas, and I echo everything that you just stated, I mean, that's relevant in terms of communicating the evidence and prevention messaging in ways that are, sorry. I wanted to just acknowledge what Tammy just said in terms of being able to present, digest information in ways for mobile and increasingly tuned into technology audience. There were also some elements in the presentation today that I thought were especially intriguing, and some ideas that I think would make it extremely useful to be able to translate evidence and have it be more quickly taken up by practitioners. And one was the idea of, and I think it was Dean Fixon, to go beyond websites that focus on what are the programmatic examples of evidence-based programming, but to then begin to look at what are some of the elements, what are the key components, what are the core elements, what are some of the tools that are used, what are the assessment methodologies, to then really be able to take these blueprints and have information that can be useful to practitioners who then want to see whether this might be a good fit contextually and experientially in terms of the types of challenges they face, the kinds of skill sets that their practitioners have, the time horizons, the resources. So I thought that was a lovely idea. The other aspect is something simple, but you are able to, you provide a lot of information, but a lot of it is still in English. So translate, have information that at least for Latin America is available in Spanish and Portuguese, and I think that would be extremely beneficial for populations in the U.S. as well, right? So it's a win-win. And then to make more easily accessible some of your research tools, the types of survey instruments that you have, the compendia that you use. I mean, I think CDC has done a lovely job in sort of culling what are the types of questions that can be used for programmatic evaluations around different subject areas. But those types of instruments are extraordinary. Also, I think one tool that we found, which is especially lovely, is the tools that were developed also by the Centers for Disease Control to help practitioners decide how to implement the evidence base. So I think it's called, and sort of taking a look at the scientific evidence, also being able to look at the contextual factors that you have within the setting, the institution that you're going to be working in, and also to be able to look at, the experiential knowledge and the background, the assets and the limitations of the practitioners that are going to be implementing it. So those types of tools, I think, are extremely helpful. But again, they're still only available in English, and for us, at least working in Latin America and the Caribbean, we need to have it at a minimum in Spanish and Portuguese.
I would say ditto. But one of the things that I wanted to reiterate is we often get trapped in jargon. And so if we could translate, and that's our responsibilities to translate what you do, into an effective and efficient manner. And the second thing is fidelity. I think Dean Fixon has taught us that very well, that we really do need good fidelity measures. And what has worked for us is tying the fidelity into incentives. So if you score certain scores, or if you do this well, you're going to see the results. And the trap is that we want to do it our way. We're taught this model, we're trained in this way, and we go back and we do it our way, or we don't do it the way it's designed to do, and then we expect the same outcomes. And the average school reform evidence-based practice in education is 24 months because we don't do it the way it's supposed to do. So the third thing that is very helpful, very critical, is coaching, technical assistance and coaching. Because you go to a training, you go back to the schoolhouse or go back to your work, and you're expected to do this on your own. And the coach can keep you focused in a way that will get the outcomes that you want. And then finally, it's, celebrate the outcomes. That is going to get the big bang for the buck. And that will translate to other places.
Jim, what are your thoughts on what types of formats make it most useful for law enforcement to access research?
I'll make this very quick. So this is, I'm now labeling what I'm about to say to you the guacamole dip paradigm, okay? I'm from California, what can I say, okay? So paradigms are very strong, and the paradigms of policing the mental model about how the police think their role should be carried out in the world. What works to control crime and disorder is maybe not what you, since you are a very scientifically astute crowd, think. So there's this notion that I'll believe it when I see it, right? We say that a lot. And I would submit to you, and I've come to believe this, that it's completely opposite of what we should be saying. I will see it when I believe it. So I'll see the findings that you discover in your work when I begin to believe that this is how you should drive policing practices, right? So if you think about all of the work you've done, if you want police chiefs, sheriffs, and other people to consume your research, and what I'm about to say is they don't consume it not because they're not smart people. Some of the smartest people I have ever met are police officers, right? They're very astute people, police chiefs, very, very smart. The issue is that they don't have time to read these big journals or academic studies and all that, right? You hand me that, and my eyes are going to roll up in my head. So think of it this way. I run into you at a party, and we bump into each other at the guacamole dip, okay? You're wondering where the guacamole came from, right? This is it. And I tell you what I do, and you tell me what you do, and I say, well, that's really great. You're a researcher, or you know a lot about this stuff. I have a problem, and that is we have violence that's out of control in my city. And I know somewhere intuitively that science can help me. I need you to tell me what you know and make this like 3 things that I can remember when you walk away from this little experience over the guacamole, because I'm hungry and I'm going to eat the guacamole dip. And if you start giving me a 30-minute rendition about the background and the science and all that, I'm going to motor on to someplace else because I'm going to munch on my guacamole stuff. So I would challenge you, if you are a researcher, to take any one of your studies, just take it and reduce it to the 3 to 5 things that you found in there that you could tell me as a non-scientist at a party over the guacamole dip, that I would go, I got it. And I'm going to go back now and I'm going to start the process of really drilling down there and doing that. But if you don't get me to believe this, I am never seeing your findings, ever. It's never going to happen because I don't have to. It doesn't matter how good your study is. That's not the incentive system I work in, right? That does. Anyway, so I would just suggest try to get your stuff to 3 to 5, and you can do this. I know the reason I know you can do this is because when I was at NIJ, this was the brainchild of John Lobb, who just left there and went back to Maryland, and he said, "Tell me the 5 things that every police chief ought to know about controlling crime and disorder in his town that are evidence-based." And this takes a while to do this, by the way, because this is what I worked on for a long time. But you can do it. You can get it down to 3 to 5 things that I should know as a police chief that are supported by all kinds of science and research, but are expressed to me in a way that shifts my perspective on the world. If you don't do that, then it's the same commentary you just meant about if the consumers are Spanish speakers and you give it to them in English, they're never going to be able to understand it. And that kind of is the same thing in policing too.
Well, I think it's hard to top the guacamole dip as final comments here. But we are getting up to time, and so I just want to give all of our panelists one last opportunity to provide any closing comments. And you don't need to respond to this question, but particularly thinking about what you've heard over the last day and a half during this conversation, has anything changed? Has anything shifted about your view of evidence? Has anything shifted about who you think, my practitioners really should be working with this group now? So this is sort of the potpourri question, but just any closing thoughts that you have. Yes, just go ahead.
Well, this is more a thought on the notion of a desire more than anything, and I think science has done a really great job of we do focus a lot on trying to understand what works, and I do think there's value in that. I don't want to diminish that. But I also think we have an opportunity to try and take and use the tools of science. And this isn't getting at what you sort of what's different for you, but I long for an opportunity for us to really focus on how we can use the tools of science to help us get better. I don't hear a focus on continuous improvement and building learning organizations and really cultivating environments where there is an interest in wanting to learn and perfect and refine and go through a knowledge development process around what you're doing in a more iterative way. And I feel that's unfortunate, because if we're constantly looking for the next best thing, what's the next best program, what's the next best initiative, what's the next best strategy, we miss the opportunity of realizing that we have people in these environments that are working day in and day out and trying to create an environment where people are open to wanting to learn about whether what they're doing matters. I just don't feel the balance in that. And I would love to see, and that doesn't sound practical, but on some level, if we could get more organizations thinking along that line, maybe we'd have more exponential impact. at the population level in some of the areas that we want to see change. We're very program focused. We're very, what is the program? And that worries me because we've already talked about it being, the challenges that we face being multifaceted and affected by sort of many drivers. And I just don't hear enough of that being talked about in the work that we're doing. So.
Thank you. I think this workshop has definitely given us a lot of ideas on how to shape and what might be some of the inputs for a new knowledge partnership that the World Bank is launching for Central America and Latin America and the Caribbean. I think we have some good ideas in terms of how to make the evidence base that has been accumulated globally more accessible. And we're hoping to be able to draw from many of the practitioners, experts here and some of the examples cited to think about ways that we might begin to improve the translation and customization of this evidence to use in particular countries and cities in the region. I think clearly we need a space and an initiative that can facilitate real-time interaction, quick dialogue and response. I think spaces for critical reflection as well. I think, too, it underscores the importance of taking much of what we know about some of this evidence base and using it to develop operational guides, using it to develop training courses. And then to really think about promoting exchanges, whether they be north-south or south-south exchanges, so that we can learn in situ from people that are working in a variety of different contexts, in very challenging contexts with multiple forms of violence in differently resource centers, and who can speak a specific language and resonate with that of their peers. So I think that's one. I think, two, if we want to move the evidence base for greater use in Latin America, we need to have a meeting such as this one in the region, south of the border. So we're hoping that this might be something that we can arrange in the relatively quick future, where we are able to draw upon the expertise that we have globally, but also bring practitioners whose first language, or researchers that are publishing in non-English speaking journals, to present on some of the work that they're carrying out in the region. And so we are looking forward to hosting that in Cali, Colombia, with the collaboration and in partnership with the Global Violence Prevention Group. So I think, one of the ways of moving work into the field is actually being closer to the field. So such a convening, I think, could have major effects just by being held in the region. So,
Jenny, any closing remarks?
Well, when I first looked at the program and the participation and was asked to do this, I said, "Why? What am I doing here?" And as I went through the day, it was really interesting, particularly around the case study. I really reflected on the similarities with going into a very challenging country and a challenging school or challenging school system. There are a lot of similar issues. And I particularly appreciate Jim's comments about taking your research and drilling it down to 3 or 4 very key pieces, because the same thing that your police chief needed, my superintendent needs. So that's something to think about. But the other piece is I'm more and more convinced of the systems approach. So when you take your evidence-based programs, us included, it really does need to be connected and tied and looked at within the context of the environment in which you're going to implement.
I don't know most of you. I have the honor of knowing some of you. So I don't know where you're all from in terms of what part of the world or what your discipline is, but whether you are a community-based organizer, you're an educator, you're a physician, you're a researcher, you all have something that you can bring to the table to help make the police be smarter, better, and more responsive. And We have a problem in this country in many, many, many communities where the legitimacy of the police is questioned. Not so much in terms of the broad institution of the police, but the behavior of the police, the way they implement their day-to-day practices framed around their belief that the way you control crime is you find every young man who looks differently and you put him up against the wall and you shake him down, right? Because that somehow is going to control crime. So, and I'm not trying to be critical of a perspective, I'm trying to make a point that police legitimacy in this country is a big issue. One way for us to get around some of those issues and get centered back on do we or do we not prevent young people from killing each other? Do we or do we not prevent domestic violence and all these other things we're talking about? Is to come at this from a scientific perspective and displace the concepts that you know from your community-based world, that you know from your development world, and you know, Jenny, from your education world, and say what is the applicability in policing? Because police work in many ways is a general business, but you can help it become, and you can help the cops that serve the people in this community be better servants and be better human beings if somehow we can get that knowledge that you have translated to them so they understand the practical implications of what you know. If that happens, we're all in a better place and fewer people die.
Join me in thanking our panelists. That was great. Good job.